On today's podcast,
Everything starts with the gut is on every blog you've ever read. And it's kind of, that's not a true statement because everything doesn't start with the gut. There's some patients where the gut's fine, but the gut is very often involved for sure. Because it's the largest epithelial barrier. So it has the greatest opportunity to be hyperpermeable, but also because up to 80% of the immune system's in there. And so if the gut's a mess, the immune system's triggered and now you're inflamed. So I guess it's my bias is that the gut matters because of how substantial the immune presence is there, more so than the gut itself.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Welcome, everyone, to another episode of the Vibrant Wellness Podcast. Today, I have my amazing co-host, Dr. Emmy, as usual with me. Dr. Emmy, how are you doing today?
I'm doing especially well. How about you, Jen?
Oh, I'm doing great. Let's talk about today. We have an absolutely amazing guest. This special guest, he is committed to uncovering the root causes of health issues and guiding individuals toward optimal well-being. His best-selling book, The Autoimmune Answer, Using Functional Medicine to Address the Cause, Eliminate Symptoms, and Optimize Quality of Life, has provided valuable insights into the realm of autoimmune conditions and their management. On his dynamic YouTube channel, if you haven't checked that out, Functional Medicine Charlotte, Dr. John Bartemus shares his wealth of knowledge, offering evidence-based and practical advice on holistic health. With his well-coined hashtag, as you can see on his shirt if you're watching us on YouTube, Life at Optimal. As society grapples with the burdens of chronic disease and the pitfalls of symptom-focused medicine, Dr. John stands as a beacon of hope. With his dedication to patient-centered care and a commitment to addressing the root causes of ailments, he exemplifies the ideals of functional medicine. So we are thrilled to welcome to our podcast, Dr. John Bartemus.
Awesome. Thank you for the great introduction. I don't know who wrote it, but they should get a bonus. So that was great.
My boss.
Thanks for having me on, and excited to hopefully share a lot of value for the listeners.
Yeah, I'm excited too. So we know a little bit about you. We want to learn more as we go through. And so we know you began out practicing more so in a conventional approach as a chiropractic doctor. What really led you to make that transition to functional medicine and living life optimal? Was there any resistance from friends, colleagues, family? What was that like?
Resistance towards my transition to the functional medicine space?
Mm-hmm.
No, thankfully I've always had support, from my parents and my siblings and my wife. So all is good there. And if anything, it was encouragement, not opposition, because I started out in I guess what you'd say, a strict chiropractic practice. And I love chiropractic, and I think it's a part of a perfect healthcare approach. But for me, I was always more of a wellness-based chiropractor and wanted to work in nutrition and physical activity and sleep and all those things too. And so when I found out there was this thing called functional medicine that was the umbrella term that included all those different things, I was like, yes, this is for me. And so it's what I've been doing without knowing it had a name, And so once it had a name and it had a bunch of, other practitioners that were practicing it, and there were conferences, and there's lab companies and supplement companies and a whole ecosystem around it. It was like a dream come true for me.
Yeah. Was it more of a personal journey for you first, I wonder?
Yes. I talk about it in the book, but it was more a personal journey of performance than it was like a struggle. A lot of people had a health struggle. I thankfully didn't have that. But for me, my goal growing up was to make the NFL. And I played college football and all that. And on my journey, I didn't want to use steroids. So I was like, well, how can I achieve this goal naturally? And so that led me to nutrition and training and trying to optimize myself as best I can in those areas. And ultimately, I didn't achieve that goal, but the journey toward that goal led me to the next journey, which is this. And knowing what I know now about head injury and all of that stuff, I'm glad I didn't achieve that first goal, because I probably would have had a shorter life and more suffering.
I'm sorry to say, but my stereotype was right, Dr. John. My husband is a collegiate football coach for over 20 years. I saw you and I thought he had to have played football at some point. You have that.
Okay, yeah,
Yeah.
I
Well,
appreciate it.
yeah, you're in very good physical shape. But so I have to admit, in looking around, on your website and, doing our research for this episode, I was really moved by the testimonials that you showcased on your website. You can see how you genuinely and deeply care about your patients and their journey. And obviously, at the similarity, even though their cases seemed all very different, the root was finding the root cause of what's going on with them. So I'd love to kind of have you walk us through your process and how you approach each client.
Yeah. So very simply, I approach each client as their own individual puzzle. So that's, my logo, that's the cover of the book. That is how I communicate to anyone in a consultation is, Jen, your symptoms are interesting to me, but they're not happening in a vacuum separate from the rest of Jen's lifestyle and Jen's physiology. So what I want to do is zoom out and determine what are all the potential sticks in the spokes physiologically in your case. Because if we can identify those, then we have objectified clinical targets that we can be accountable to. We can create a strategy against, take action, and retest down the road and say, look, your numbers were here, now they're here. The paper's changing, awesome. We also want you to feel better. So can you fill out these questionnaires and rate your anxiety 0 to 100% better, your fatigue, your digestion, your pain, your sleep, your attitude, all that stuff. And when you're also improving there, your quality of life is improving. And so we want to see you feel better. We want to see the paper change. And ultimately, I want to be able to say, Jen, high five, great job. We've co-created the lifestyle that we know works for you. So the only magic bullet now is to stay disciplined, keep doing it.
You must be psychic because I'm thinking about unique intake processes with different functional medicine practitioners, Dr. John. So I'm wondering, is there anything unique in your opinion on your intake form for a new patient? For example, environmental toxin exposures, adverse childhood events, quality of social life. Maybe you get more specific in terms of how often, maybe does somebody go out per week with friends, have some kind of social event, anything there you want?
All of that stuff's in there because my intake form's 40 pages.
Wow.
And that's by design for two reasons. A, we want to collect all that information because it all potentially matters, right? But then B, I only want patients who are committed. And so 40 pages of intake forms hurts more than their current complaint, then they're not ready for me anyway. So it kind of saves energy for me as a clinician to not have to work with someone yet who's not ready. And that's fine. There's other practitioners around who will work with those people. I just want people who are committed and a certain level of commitment.
So I was going to touch on that later, but this is the perfect time for that. I know a lot of private practices will screen their patients. Well, at that point, they're patient candidates, we could say, for good reason. So I love that you are touching on that. And I'd love you to repeat what I think you just said. You said the process of doing the intake form might be more painful for some versus what they're struggling with. And if that's the case, we probably don't necessarily want to take them on because they might not be really willing to do the work. Is that right?
Yeah. So my thought is, we've all had patients that are tire kickers is what I'll call them, right? So they want a $200 a month nutrition plan that they're not going to follow so that they can go out and say they did something that they didn't do and blame you for being a bad doctor after. And so you then have bad Google reviews or at least the bad word of mouth, and the patient never tells the person they're talking to, well, I didn't actually do what he said, right? And so that is a time suck and an energy suck for us and a resource suck because now we have to, deal with those Google reviews or whatever, or put more into marketing to overcome the bad perception of those Google reviews. And it's just like the person was never in to begin with. So for me, when I was setting up, I was like, I want to have obstacles to care and you have to actually pass it, right? So it's kind of like a Spartan race intake, right? You have to do the 40 pages of intake. We're requesting your previous medical records. You're writing me a health history. You're paying money up front. There's these different things that you have to have skin in the game because if you go through all that, people don't start and then stop with me because they've already committed. So as a clinician, it's cool because you've got finances up front, okay, to help support the practice. You've got people who are committed. And so you can confidently move forward and say, put your own energy into that case, knowing it's highly unlikely that they're going to drop out.
I like it because it's a vetting on both sides. I'm sure they vetted you by researching, but you need to vet them and make sure it's a good fit. I like the acronym ACT, Application Creates Transformation. If you don't have a patient who's willing to apply what you're telling them, that's a tough spot. So.
And it's, it all depends on what kind of practice you want to have too. But for me, it was just, I like to noodle through the nuance and detail and figure out pathways and physiology and that sort of thing. If someone just wants to know what supplement should I take for X, it's like, you can Google that, So if the people I see often are saying, hey, I've been to 10 doctors and you're my last hope or whatever. And it's like, cool, challenge accepted. Like, you're ready. Yeah. And that's how I want to be. Some people, if I had stayed a chiropractor and just wanted to keep doing back pain, or neck pain or whatever it is, that's that person's choice. And we need all of the different doctors. But for me, wanted to set up the obstacles.
So let's switch gears to your book, The Autoimmune Answer. I'd love to know, what was the inspiration behind writing a book? I mean, it's not for the faint of heart. I don't know if you did it on your own or you had a group collaborating with you, but I know you co-authored it, I believe.
I wrote 100%. It's just the foreword was not written by me. A colleague of mine wrote the foreword, but I wrote it all. And that was important to me, was to have written every word, because there's a lot of ghost writers and things out there. And I wanted to be able to say, I wrote this. I want to be proud of it. So for me, it was, like you said, a labor of love of, sit down, and every Tuesday morning and Friday afternoon for a year was like, I'm going to go in the hole and write and come out later.
That discipline.
And for me, I looked at it as, hey, it's authority. It was just something I always wanted to do in my life too, is just, have a book, because hopefully it will outlive me and still be read when I'm gone. It's something my kids can look at and be like, hey, dad did this, and maybe it'll influence them to move in this field. But then also I wanted to be able to make it more hard on myself and write a book that would work for lay people, but also clinicians, right? So the double task of showing lay people, hey, there is a different form of healthcare. Just because you've been to Duke and Mayo Clinic and Cleveland Clinic and been failed by them all, because they're not any different than any other poor conventional medical clinic around. They just have all the doctors in one building. You don't give up after that. There is another paradigm. And for clinician suicide is a major issue that is not talked about a lot. And these clinicians are well-meaning doctors that got in to help people, and they find themselves in a model that makes them a pill vending machine. And they're like, this isn't what I wanted to do, but they may not know that functional medicine's out there, and you can learn the skills to do functional medicine. You can learn the business knowledge you need to run your own practice, and you can actually live the life of your dreams, being that doctor we all envisioned ourselves being when we entered school. And so I said, can I do this in one book? And I think, conservatively, I think it's accomplished its goal, at least from the feedback I'm getting. So I said in the beginning, hey, they tell us to write it at a 6th grade level. I can't do that to give you the information I want to give you. So, I'm going to give you the nerdy stuff, but then I'll give you an analogy or metaphor or a 6th grade description. So hang in there with me. But, we need to take you to the next level for you to understand why you need to seek out this kind of care. And then the third reason is, I can't see everyone. I couldn't possibly see all the people that need us. And so, a book, this book sells in India, this book sells in Europe, this book sells everywhere. So I can help people that I'll never see, right? But there may be functional medicine clinicians in India or in Europe. I know there are in Europe. So it was a way for me to help influence someone's journey that I may never actually touch or meet. But, the Amazon review where they say, hey, this really helped me, it's like, awesome.
I just want to point out a side note. Your discipline is like uncanny. And I think that's another great characteristic to have in a doctor or provider. You mentioned the Tuesday, Friday thing, but I also was listening to another podcast that you did where you talked about, you gave yourself the goal of going live on, I think it was YouTube, to upload a video every day for a year. And you went to like 400 and some odd days. So
411.
Yeah.
Yeah. And the only thing that broke the streak was I went to Spain. So I was like, I don't know if I'm even going to have, Wi-Fi and all that stuff to do. But yeah, that was important because, again, like many clinicians starting out, I didn't have a lot of money. So it was like, you can pay a lot of money for print ads that are dead, or you can pay with time, right? So for me, it was, I want to pay with time, and I'll commit my time to producing content, which again is evergreen once it's up, right? So this podcast can stay up forever after this. So we could, all three of us, help somebody in 10 years if they view it, right? So for me, it was like, I do CrossFit. In the CrossFit space, there's a guy named Kelly Starrett, he's the big mobility WOD guy. He's the PT that teaches you how to stretch and foam roll and all that. And, he started out as just Joe PT, and he said, I'm going to make a video a day for however long. And that's how he grew. And I watched his stuff and I was like, well, I can do that. So it's just, discipline is the key. And that's a theme in my life, is discipline. If we can be disciplined, we could be less talented, but more disciplined and beat, the more talented people.
That's profound. So, and I love how you talk about the book inspiring practitioners and both patients, and particularly practitioners, in terms of how to do medicine maybe a little bit differently to inspire them and to keep them going and keep them from burnout in terms of the conventional practice. I think that there's a lot to unpack there. That's a whole, another conversation, but I really value and appreciate that you mentioned that. But going back to your book, you wrote it for both practitioner and patient. Can you give us an example of how your book has helped both practitioner and patient? Have you heard any feedback from each type of person or reader?
Yeah. So just your other point real quick.
Yeah.
I might be a little off on the numbers now, but the prediction is by 2030, I believe we'll be at 120,000 doctor deficit for the population. Mm-hmm. Okay. So, and the numbers for diabetes and Alzheimer's and these things are not going lower. Diabetes itself can bankrupt America. Alzheimer's itself can bankrupt America. So we need more clinicians, but we don't need more clinicians doing the same thing because, the numbers for diabetes and Alzheimer's are going up no matter how many new drugs are pumped out. So we need more clinicians, and we need more clinicians doing the right medicine. And for me, I look at functional medicine as 21st century healthcare. And so you can see conventional medicine seeing the writing on the wall because we're seeing the expansion of scopes of practice for PAs and nurse practitioners and things expanding because they realize, hey, we're not going to have enough MDs and DOs. And even if we did, they're not thinking the way that will lead to health, right? Or they're not allowed to practice the way that will lead to health. The other question was, examples. Yeah. So actually the book has, obviously, if you write a book too, or you start a podcast or a YouTube channel, you hope that people see it and reach out and become patients as well. So that has happened. My YouTube channel is, besides Google, is my number. So I guess it would be my number 2, like, patient source. The book, I don't know where that would rank, but I've had multiple from the book, and I've had multiple people travel from the book. So I have one patient who found me through the book that traveled from Utah with autoimmune hepatitis, and she'd just been seeing her hepatologist or liver specialist, and she's getting worse and worse. She's on an immune suppressing drug with the liver specialist, and she says, well, what else can I do? And the liver specialist literally says to her, don't come back unless you're turning yellow. So, like, basically, unless you're jaundiced, there's nothing I can do for you. And so it's like, so her life just continues to fall apart with autoimmune hepatitis because she's not yellow. It's like, so she was fed up with that and was willing to fly from Utah. Doctors, a doctor example, I actually get direct messages on Instagram quite a bit from students in NP programs or PA programs or, MDO, whatever. So people have come across the book and said, thank you so much. I didn't realize this was out here. I want to practice this way. And most commonly it's nurse practitioners. And I found that, nurses have been on the front lines because to become a nurse practitioner, you have to go be an RN for a couple of years in a hospital environment or in a clinic. So they've literally practiced conventionally. They've seen kind of the strengths and weaknesses of that and experienced, was it fulfilling for them or not? Well, in there, probably not. That's why they're moving the NP way. And then the NP way allows them to be autonomous in how they practice in their paradigm. So it's been really fulfilling to see different nurse practitioners reach out and say, thank you so much. I wasn't aware of this and I'm going to do this. And if you make a course, let me know, and blah, blah, blah. Like they want more of my stuff too. So I don't have the course yet, but I just like to see that and encourage them and say, hey, as you grow, let me know if you need more help or more.
That's so cool. And I just want to use this opportunity to shout out nurses because, like you said, they see everything in terms of the conventional practice, and they're really holding the hands of these patients through everything. And so it makes sense that nurses who become nurse practitioners, they tend to want to go the holistic route. I've seen the same thing firsthand.
Yeah. My sister's one of them. She's been a cardiac intensive care and a neurotrauma burn unit nurse for 20 years, like in those different fields. And she's great at what she does, but she'd be frustrated that, you've got a patient about to code on the floor and you call up to the attending doctor and they're like, no, that patient's fine. It's like, no, I'm standing here looking at the patient and been taking care of the patient for 24 hours, and that's frustrating because, again, even if that patient's not going to code yet, right? It's still, she's seen signs that it's going to lead to that. And so if we wait longer, it's just like functional medicine, like, oh, they're not diabetic, they're just pre-diabetic, don't do anything. It's like, no, in functional medicine, we want to catch you not before you're even pre-diabetic. We want to see, hey, your insulin's just functionally high. Let's turn this ship around before, we can save all the healthcare expenses, we can save all the suffering, we can save lifespan. It's all kinds of things we can do.
Well, I definitely we want to dive into more of your holistic integrative approach as it applies to your patients. But I always think it's helpful for not just us, but our listeners to take a peek behind the curtain of your everyday life. Obviously, we know you're a very disciplined person, but can you share with us maybe some day-to-day routines or habits that help support your optimal health and the health of your family?
Yeah, that's a surprise question. So, yeah, I eat, I sleep, I work out, I go to the office. But more seriously, I shoot to be in bed by 10 each night. That's difficult because I have 5 kids from 12 down to 4, and they're in baseball and swim team and all of this. So, 10, if I'm in bed before 10:20, that's a win. If I eat dinner before 9, that's a win, which in our field, we know that's maybe not the best way to eat for your circadian rhythm and all of that. But again, life happens too. So I leave the office, go to a game. The next time food's available that is worth eating is when I'm home, so I'll eat when I can eat. But I follow, like, for me, a paleo diet for athletes, which is basically the paleo diet. And then you can have like white rice or some higher glycemic carb in your post-workout windows when you're most insulin sensitive. I'm going to pull that out. But I don't think, I don't have a diet that's for everybody. Chapter 9 of my book is There Is No Perfect Diet. So it's basically, again, for Jen and Jen's physiology right now, what is perfect for her. And that diet might not be perfect for her 2 years from now. So it's there's a lot of, we get so hung up on no, keto's best or paleo's best. We like try to identify with a diet and our egos are hurt if someone says, it's like, no, it's just a tool. Just like, CrossFit's not the best form of exercise necessarily. It's what I like to do and what I can do. But there's a lot, if my patients tried it, they'd be hurt and we'd go backwards, right? So it's just what's right for the person in front of me right now. And so that was a little off track, but yes, the day in the office, yeah, we can go this way. When I was setting up my practice, I wanted to build my practice around my life, not my life around my practice, right? Especially because I have 5 kids and I wanted to be a dad who's there and a husband who's there. So I could easily, work more and do all that and make more money and whatever. But if I'm not at the kids' baseball games or swim meets, like, no one remembers the money I made this week in 20 years, but they remember Dad was at all the games, right? So I only see patients 3 days a week. And I'm there 9:30 to 6 Monday. 9:30 to 3 on Tuesdays, 9:30 to 6 on Thursday. And so I'm doing things other days, right? But Wednesday and Friday is more admin, paperwork, marketing, content creation, that sort of thing. And that stuff's more flexible around life. So I can, I don't have to be in office to do paperwork or whatever. So when kids are in school, all that. So for me, I've mentored some doctors, and I had a phone call with a DO last year who was trying to pull out of conventional medicine and start his own functional medicine thing. I told him I only work 3 days a week and, whatever. And he was like floored. He's like, what? Yeah. So
What?
coming out of a hospital system, it's like, what? I worked 3 days, the first 3 days this week, so three days worth of hours, he worked 36 hours the first 3 days, say, no, so for me, I'd like the people watching this to understand, like, there's really no hard, fast way to practice. It's what do you want your life to look like? And you can make that work. And so, you have to understand, if I want my life to look this way, or you have a certain money goal you want to hit, well, you can hit any money goal you want by seeing 1 million people for less price or fewer people for greater price, right? And so the way I want to practice, I see fewer people for a higher price because I want to be able to put the time into, again, do the detective work to figure out what's going on in their case, sit down with them, show it on the labs, draw it out for them, just get them to understand it. Because I believe if a patient's empowered with, here's the physiology, and yes, it's higher than 6th grade level, but if they can understand that, then they know when things get difficult in their plan, as they will, because we're pushing their comfort zones, they know, hey, he knows what he's doing. He explained it to me, even though I probably forgot it by now. And he said, I may feel this way, but he was right again, right? That sort of thing. So it's a trust thing. Like, if you don't educate them and warn them, an informed consent kind of thing of what could happen, then once they feel bad, they're like, I'm out of here. This isn't working. And then again, it's that doctor didn't help me, whatever. But if you can educate them and say, hey, listen, if we're doing an antimicrobial strategy in your gut, you may feel worse before you feel better transiently. Okay. I'm not guaranteeing that's you, but I don't know if that's you, because no doctor knows how anyone's going to respond. So this is possible. If I tell you this up front, you trust me later. If I don't tell you till it happens, you think I'm covering my backside, right? Yeah. So it's just, what do you want to do? I want to be able to, from a business model, a lot of people want to scale, right? They want to take the practice and scale it and then have multiple locations and all of this. I don't want to do that if it's going to sacrifice the integrity of the care I'm providing. And that's just a choice I've made right for me. Okay. So if there's only me, unless I add doctors, if there's only me, then my time is limited. So my price will have to go up if you want to work with me over time. And that's fine, because, if we get the results we get, then most people would pay whatever when they're in the situations that I usually meet them in.
There's so many nuggets. I'm hoping that the providers listening can take a page out of your book, because you've said a lot of really profound things. Just, again, it kind of comes back to that quality over quantity of patient, making sure you've got the right patient that you're working with, but just your priorities and figuring out what your goals are and what you really want out of your practice and your life. So thank you for sharing that.
You're welcome. I think it's important to, and I'm human too, but we tend to, or as a whole, at least our population, I think that the last 3 years is a kind of a good example of it, is we kind of float through life without ever sitting down and saying, what do I believe? What is my philosophy? Right. And so if you don't know what your philosophy is and what you believe, then when things happen, you react, right? Versus, standing, and so if someone says you're going to lose your job unless you do this, if you've never thought through it, then you just do it, right? Because you're like, well, I got to have my job. But if you're like, here are the boundaries I'm setting for my life personally, if they say you got to do this or you lose your job, it's like, well, I don't need this job. I can do something else. Or, the discipline piece, Americans, I think the numbers are atrocious in terms of what the average American has for savings. It's like 0. And so again, if we're not financially disciplined and your job is now at risk unless you do something, you're being coerced into doing something, well, now you're less able to stand for your beliefs because you haven't created the margin, because you haven't had the discipline, right? Oof. So discipline, I'm biased towards discipline, but the discipline for me is important.
Essential.
And so I would encourage anyone watching, like, sit down and just say, what are my beliefs? And it doesn't have to be spiritual, or it's like spiritual, political, health-wise. What are your beliefs about what you can do for a patient in what time period, right? I personally see patients in 3-month blocks, assuming they need that much time. But that's usually what I do. Some might need less, and I just do less if they need less. But my personal opinion is if you're signing a patient up for 12 months of care, you probably haven't figured out exactly what's wrong to the nuanced enough, right? Because the body wants to heal and to change. You shouldn't need 12 months to change it. 3 months is, I think, understandable because we have A1Cs and C-peptides and different physiologic markers that change over a 3 months or 90-day period. So it's like, hey, this is a pretty objective way to look at it. And if I tell the patient, if I did my job, which is figure it out, and you do your job, which is go do, then we should see change in 3 months at max. And usually it's by 3 weeks. And how do I know that? Because I track data. And so we have, here's the latest outcome, but I have patients fill out progress questionnaires at 6 weeks and 12 weeks every time so that I can make something like this that is, here's our average outcomes for patients for a specific complaint at 6 weeks and 12 weeks, and that way when a patient says, okay, I'm going to invest this money in myself, but when will I feel better? I can say, Emmy, I can't guarantee this to you, but the last 100 patients with your same complaints on average at 6 weeks are 50% better. Okay.
It's evidence-based at that point.
Yeah. And so, they've probably never been to a doctor who could say that, right? They're just like, oh yeah, well, you feel better. It's like, if we can have that evidence again, which functional medicine needs to be able to take its rightful spot as 21st century healthcare, having data to back up what we're doing is important. So I kind of look at, I haven't got around to it, but someday I would love to be able to take all the data from my office and show, do a clinical study with it, like have some biostatistician come in and be like, blah, 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 look at all this. And so, we follow labs and we follow subjective outcomes and we follow body composition and we follow cardiovascular stuff. So we can say, the average patient in our office over 3 months loses 9.8 pounds, or whatever.
Yeah. You can't argue with data and facts. And I think that's awesome that you do that. I don't know if most practices do, but I think it's so important to have that data to show. Yeah. And I love that you have those follow-up questionnaires for your patients. And I'd imagine they're probably pretty excited to fill them out once they start feeling better too.
Yeah. They are. And for me and for anyone else out there who wants to adopt it, it's really helpful going into a re-exam ROF because I already know how they're feeling. Right? Yeah. Because who out there gets anxious about re-evals when you haven't talked to them and like, you don't know, are they going to come in and be like, I haven't changed at all. Your program stinks, blah, blah, blah. Or I can go in and I have their 6-week questionnaire and I'm like, wow, they're rating 50% better in anxiety, 75% better in energy, 0 regrowth of hair so far. Okay. But it's like, they're doing better. Right. And so if they haven't regrown hair yet, but they have 75% better energy, they're happy. Right. And they're happy to continue. So as a practitioner, it'll help you have less anxiety going into visits when you've got that information ahead of time. And that helps you manage the visit. So my re-eval visit will be 30 minutes. Well, if you're just finding out that information after you question them and the visit can go long, especially if they're not feeling as good as they want to. So they have all these questions and everything. So now you're going over and you're off track the rest of the day and you get home and, you're burnt out and maybe family suffers because of it. So if you can know ahead of time, whether it's good or bad, you can approach it that way and hopefully stay on time.
Well, it sounds like you may not have this problem, Dr. John, because you are so thorough and so data-driven, but do you ever find your place, and I'm saying this also so other providers can maybe glean some of your insights, where you get kind of stuck in the metaphorical puzzle that is unique to each of us? Do you ever find yourself in a place like that? And what do you do? How do you move forward?
I probably have, and I don't want to sound like nothing.
It never happens, Jen.
Yeah. I think, and I don't want that to come off bad. Like, I don't know everything. I haven't helped every patient I've ever seen, all that. But I think being data driven and having systems and things allows that to happen less, and also continuing to learn. Like, I'd never stop learning because we'll never know it all. So I want to learn as much as I can. So that gives me an edge too, right? If I'm disciplined in my learning, then, I'm going to be ahead of doctors who are happy with what they know, And I think I'll answer your question in a second, but I think that branches out to a soapbox moment for me for functional medicine is my belief, if you talk to doctors at a conference, they'll be like, well, what do you do? It's like, I do functional medicine. But you'll hear other doctors be like, well, I'm a thyroid guy or I'm a diabetes guy. And I think that's dangerous because then you're looking at every patient who walks through the door as a thyroid, whether or not thyroid's a problem, right? So it's that confirmation bias of, well, I'm going to treat this patient as a thyroid and their thyroid might be fine. So for me, I'm not a thyroid guy or a diabetes guy. I'm a Jen guy when Jen's here. I'm an Emmy guy when Emmy's here. And so to be that, though, you have to have enough of a knowledge base to, work with Jen's hormones, but work with Emmy's thyroid and work with Tom's blood sugar, right? Mm-hmm. So that's the soapbox piece. If we really want to do functional medicine, we have to look at the individual as the individual, not as whatever our favorite organ or gland is to treat. Mm-hmm. So what do I do if I'm stuck? Well, I had a hashtag and I've posted many times, principles over pandemic during the last 3 years, because again, rather than being feared into something that we haven't thought through enough to know what we want to do, if we return to principles, we can probably save our hides. Okay. So, during the whole time when they're saying, oh, vitamin C is useless against viruses or natural things are useless, it's like, well, let's return to principles. There's piles of papers on the usefulness of vitamin C for the immune system and the antiviral response. So probably isn't useless. There's no papers on the benefit of this thing you're asking me to do, So if I'm with a patient and I'm like, well, what do I do here? Start with the lowest common denominator that shows up in their case, right? So, I'll explain to a patient, conventional medicine often wants to chase the sexy thing. So it's your diabetes or your rheumatoid arthritis, and they don't look at the underlying fundamental things that may be off. So for example, energy systems. If you have a problem producing energy, then how are you going to heal? Right? You need energy to do any metabolic process, including heal. So if a patient's got, say, a rheumatoid arthritis or diabetes or any diagnosis that they haven't responded to other doctors with, well, I'm going to start with energy systems. Iron carries oxygen. Oxygen becomes energy. We have to understand iron physiology. Blood sugar, because glucose is energy and it's the most efficient source. Thyroid sets the metabolic rate of every cell, right? So we can assess those three areas. And oftentimes there's iron issues, whether too high or too low. Too low is fatigue, poor energy production. Too high is too much oxidative stress. They're rusting out from the inside, right? So it's like, if I'm struggling with what do I do here, there's always a stick in the spokes, right? So just start with the sticks that are most fundamental, because they may be linchpins. You fix that part, and then these upper sticks, some of them might fall out. Does that make sense?
Yeah, well said. And on that note, I'm sure you use labs to monitor a lot of these things. And yes. I'm wondering, Dr. John, what do you consider?
This is a vibrant podcast.
Well, I am curious. So not routine labs in terms of foundational, because you are talking about foundations to health, but what do you consider foundational in your panel labs for complex autoimmune cases, for example?
So again, if you haven't been able to tell, I like to do it individualized and specific. So I don't run the same labs on everybody. So the labs I'm going to run on you are dictated by your history and medical record review up to this point. Because, for example, people who love to run an MTHFR SNP, right? It's like, well, if you haven't reviewed their medical history and seen that it was already run, then that was redundant and you wasted their money.
Yeah,
right?
Great point.
The history medical record review helps me know the patient up to the minute. Here's what's been done. This genetic stuff doesn't need to be rerun. Their genes aren't changing, so we can look over here. But blood is always going to be involved, because blood is, fundamental, and blood is the universal language for healthcare. So you can establish, from a liability standpoint, if I've got LabCorp saying X about a patient, and for some reason I was taken to court, it's like, well, do you know who LabCorp is? Right? Yes. Well, then this was, I feel like the court would be in my corner that way. It's like, We know LabCorp is. Versus if I said I muscle tested the patient and I saw this, and, the opposing lawyer would just take me to lunch with that one, and that's not to say anything. Muscle testing helps a lot of people, but I'm just, again, when I was setting up what I want to do, it's how do I protect myself and be as objective as possible with it? So blood work, you said complex autoimmune case.
Mm-hmm.
Okay. So we don't know a diagnosis, or you have a specific diagnosis?
Well, let's just say rheumatoid arthritis. Maybe they're struggling to get relief. Maybe they just transferred from a rheumatologist. And looking at things holistically, you mentioned fasting insulin, and I'm really curious what your optimal is for fasting insulin. But speaking of metabolic markers and of course we have to individualize, but I imagine there are things that you want on almost everybody because they're so foundational if they haven't had them recently.
Yeah. Yeah. So I like less than 5 for fasting insulin. I like less than 1.5, probably less than 1.3 for a C-peptide. Yeah. So for the RA patient, I like to prove it to myself too. So I don't assume the diagnosis given by another doctor is correct, because oftentimes there's nothing in the records to substantiate that. Yeah. So, on the RA patient, I would want to see a rheumatoid factor. I would want to see a CCP antibodies. If there hasn't been an HLA-B27, I'd be interested in that. What's their CRP? What's their ANA? I want to know their A1C and their C-peptide. All those fundamentals. I want to see the iron panel. I want to see a thyroid panel, so we know that the energy piece is there. Of course, a CMP and a CBC. I really like transforming growth factor beta as an oxidative stress marker, as a marker of epithelial cell damage. And as a cytokine, it really drives the immune system towards a Th17 bias, which is the phenotype that drives the tissue damage and autoimmunity. So if they've got in combination with a high CRP, which is surrogate for IL-6, those two things together drive that Th17 response. So if we've got a RA patient that isn't getting better and the CRP is really not moving, and if they've only been in conventional medicine, they've never had a TGF-beta, then we can run that and see, look at this. If there haven't been SNPs run, an IL-6 SNP, a CRP SNP, a TNF-alpha SNP are useful, because if they have SNPs there that make them more susceptible to be inflamed, we may have to have the conversation of, listen, and they're being expressed. We may have to have the conversation of, listen, you have a genetic makeup that makes you more inflamed, right? So yeah, we'd love your CRP to be less than 1. It's 17. We've never seen it lower than 13, right? And so 13 might be the best for you. So we know at 13, this is the best you are. So knowing that moving forward, if you go out and you're feeling worse and you come back at 17, we know you're in a flare, right? And that's one potential way to communicate that. And then, we're always pushing to, hey, can we get 12? Can we get 11? To the patient's tolerance. But we have to understand that optimal range isn't always possible with a given patient. So having that background information, I've actually had an RA patient like that where we improved, but not all the way back. And ultimately we ran the SNPs, and he had an IL-6 and a TNF-alpha SNP. And it's like, okay, I think it was like 8.3 or something was the best we'd ever had on him over multiple different lab tests. And it's like, okay, 8.3 is our optimal so far for you. So we know on future tests, if you're, 8.6 or 9, you're probably at your good baseline level. But if you come in and you're 13, you're flaring. And you have, if your symptoms are worse too, that helps.
Right. But, it's all relative.
Yeah. And then, a stool test is great, because up to 80% of immune system's in the gut. So if the RA patient's not getting better, they've probably never had their gut looked at by a rheumatologist. So understanding what their gut looks like and dealing with anything there, like Prevotella species or Klebsiella species, or different species that are cross-reactive with RA, if they've got overgrowth of those, knocking those down may help the case a lot, because now you're removing that cross-reactive bug, right? So the immune system could look at Prevotella as if it's joint, okay? And that can flare the response to the joints. So it's called molecular mimicry or cross-reactivity. Talk about it in the book a little bit. But so the stool and the blood, I definitely want to see in that patient.
Yeah, fair. I love how you give specifics too and tailored it to an RA patient and brought in the stool, because that is really kind of all encompassing, tells us so much. So yeah, makes sense.
And I might have a little bit different look at it. Like, everything starts with the gut is on every blog you've ever read. And it's kind of, I mean, that's not a true statement because everything doesn't start with the gut. There's some patients where the gut's fine, but the gut is very often involved for sure. Because it's the largest epithelial barrier, so it has the greatest opportunity to be hyperpermeable, but also because up to 80% of the immune system's in there. And so if the gut's a mess, the immune system's triggered and now you're inflamed. So my I guess it's my bias is that the gut matters because of how substantial the immune presence is there, more so than the gut itself.
Well said. I concur, Dr. John.
Cool. That's two of us.
It's like you're a true detective and investigator. I mean, there's so much that goes into that. And I'm just always blown away by the amount of care and personalization that goes into each patient. I was going to ask you, in regards to the treatment and care for autoimmunity, what do you see as the next paradigm shift? Or are we currently in it? Or if not, are we a ways off? Like, what do you foresee for that?
I think there's always things on the horizon that give us hope. So you could say peptide therapy, or CBD was sexy for a while, and NAD plus was sexy for a while, but those things usually let us down after you've got a couple months to a year with it. So, and some of that's marketing because you can build industry around that. But I think really the paradigm shift is the functional medicine. And again, I'm biased because I'm in functional medicine, but the real paradigm shift is the lifestyle piece and the discipline around the lifestyle, like an NAD or a CBD or a peptide, or, patients our society really understands pretty well, I need to clean up my diet and I should take supplements, right? So a patient will say, well, just tell me how to eat and what supplements to take. And I'll say, well, that's not going to help you. If that's all you needed, you wouldn't be here, right? Because I'm sure you've Googled that a million times and you've had some of those $200 a month nutritionists and all that stuff, right? But you got through the obstacles to ask me that. Come on, you can do better, right? So those things are key in each case. But if Jen's puzzle, 100% of Jen's is the puzzle, right? So some percentage of Jen is probably some sort of nutritional tweaking or cleaning up or wholesale change, depending on who Jen is. Some percentage of Jen's 100% is going to require supplementation, probably more so on the front than as we get further into care. But then some is physical activity, some is sleep hygiene, some is toxin avoidance, some is stress modulation, some is internal dialogue and relationships and all of that. So for me, I think the paradigm shift would be if we all adopted or instituted in our care plans at least the assessment of those areas, and then addressment, even though that's not a word, of those areas for people that is relevant for. Because again, there is no perfect diet, so we do want to tweak that to the person correctly, but just that probably isn't going to be enough for the person if they're in a bad relationship or they're lonely, right? So taking care of that also, because that stress physiology impacts the IL-6 and blah, 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 blah. So the paradigm shift is to look at the person as a person, I think, versus a joint or a thyroid or a whatever symptom, whatever named symptom their autoimmune disease is.
Yeah. I'm hopeful we'll get there.
Yeah,
Totally.
I think we are slowly, but also quickly, relatively, So we've come a long time and a long way in a short time. So, and I think, podcasts like this and you guys spreading the word is helpful. Great labs like Vibrant and providing innovative testing that allows us to turn over new puzzle pieces that we couldn't do like 10 years ago is very important. Research that is behind those biomarkers is very important. And then as doctors continuing to learn and read so that we're up to date and know how to best utilize the Vibrant tools and other tools available to us for that patient is important.
Right. And that's such a good segue, Dr. John, into my next question. And while we're wrapping it up, so it'll be the last one, but what kind of training, and I imagine maybe you're thinking of starting your own, maybe you should, Sounds like you should. But at this point, what training do you recommend for providers to really learn root cause medicine? Because there's a lot that goes along with this, obviously, and particularly for managing autoimmune disease.
Yeah, like named courses or?
Yeah, I mean, or anything, books, any kinds of resources that you find helpful, or just tips, coordinating with other practitioners, even coordinating care with maybe a more open-minded functional medicine oriented rheumatologist, I wonder.
Yeah. Well, obviously, the best thing to do is to read this. No, just kidding. But yeah, read it and leave an Amazon review, please. Yeah. But no, I think honestly, there's a lot of good courses available. There's Functional Medicine University. IFM has some good stuff. The different supplement companies put out a lot of good seminars. But I think for me and my nerdiness, if you're just getting started and you really want to learn, you want all the information you need at a baseline level to get started in functional medicine quickly, so that you at least have it. You might not synthesize it all, but you have it and you can study it at home on your own. The seminars by Apex Energetics, I haven't seen anything better.
Cool.
So you could go spend a lot of money at IFM, or you could go spend a couple $100 on a 3-day with Apex seminars, and just their Mastering Functional Blood Chemistry seminar 3-day is amazing. I think everyone should do that. And if you're just getting into functional medicine, I mean, that's going to give you the baseline. You have to go study it after that, but it'll excite you. And then they have a Mastering the Thyroid seminar. They have a Mastering Brain Chemistry seminar. They have sex hormone seminars. So, there's great stuff all over the place. It's just finding teachers that you really do well with.
Sure. Thank you for sharing that. I think that's very valuable information for our listeners. And there's so much more to unpack, but we're going to wrap it up here. You've provided so much already, and we've touched on the importance of functional medicine. You've even provided some business coaching tips here and there, which I wasn't expecting. And I think, again, the providers listening will be really grateful for that. And it sounds like you have some really clever approaches to how you run your clinic to really walk the talk yourself. So I really applaud you for that. And I just want to thank you again so much for being here, Dr. John Bartemus. It's been a pleasure. Before we send you off, we want to learn a little bit more about you personally. So we're going to give you 3 rapid fire questions, non-clinical in nature, if you're game.
Let's do it.
All right. You go first, Jen.
All right. First question. You get to hit the gym with one person, living or deceased. Who would it be and why?
Interesting. Alex Hormozy.
I love Alex.
Because he's Diesel. He's got a sweet beard, and he's the smartest business person I know right now. And he's got a great podcast. And for the doctors out there, if you haven't seen Alex Hormozy, buy his book for 99 cents on Amazon. Listen to his podcast, The Game, because your practice, if you implement that stuff, your practice will change.
Cool.
As you were talking too, I could hear Alex coming out of you.
He's a little bit liberal with his language on podcasts. I'll keep it clean.
All right. So next one, 2 out of 3. What's your perfect vacation, and have you experienced it yet? I'm wondering.
These are good. Yes, I've experienced it many times in my life, because my perfect vacation was going to our family's lake house at Lake Sunapee, New Hampshire, every summer. It's a lake you could drink. There's mountain view straight across the lake from our diving board, and it allowed the whole family and cousins and everyone to come together to literally put your phone on the dresser and 10 days later come back and get it. Yeah, that's the best.
That sounds like a dream. Mm-hmm. All right. Last one. What's been your best failure to date and why?
There's a couple. Not making the NFL would rank up there because it led me to talking to you ladies. But also, I don't know if it's considered a failure. I failed to dress up or care at all the night I met my wife, and it didn't matter. She's still willing to dance with me. So, and I guess, so that was kind of a stretch of your question. But long story short, I met my wife even when I wasn't looking my best.
It worked out in your favor, huh?
Yeah.
And 5 kids later, it sounds like you guys are doing pretty good. So
yeah, takes a team for sure.
Yeah. Well, wonderful. Wrapping up again. Thank you so much, Dr. John. Honestly, I know I've learned a ton. I'm sure our listeners have. Oh, go ahead. You want to
I thought of a failure. Can I give it to you?
Yes,
Okay.
give it.
So I came out of chiropractic school, very idealistic and cash focused and save the world and all that. And I opened my own practice and I lasted about 15 months and then I failed or had to close down because I didn't know what I didn't know about business. You do all your schooling to become a competent, not even a good clinician, but just, pass boards and 1 hour of professional development a week through your education isn't enough, business wise to get you where you need to be. So that failure led me to, working with someone for a short term and diving into the business stuff. So, E-Myth Revisited and stuff like that, all the business learning stuff so that I could come out, better and this time have a business behind my practice, right? Not just be there and think people are going to buy wellness, So I'd encourage those who are in school and seeing this, you have to learn your trade, but also learn the business side, especially if you want to, be autonomous and run your own show, because you can be the best clinician in the world, but if you can't, pay your rent, you're not helping anybody.
I love that. Thank you for being vulnerable and sharing that. That's what failure is. It's, we learn and we grow from that. So you obviously gained a lot of wisdom from
Fail
that.
forward, right?
That's right. First attempt in learning. That's what I always tell my kids. That's what it stands for.
That's right. Exactly.
Awesome. Well, again, thank you for being here. And I know you even mentioned that for any listener who maybe would want a copy of your book, that was something that you were going to offer. Let our listeners know where to reach you. Where can they find you? Where can they find your book? And, just where they can find all things Life at Optimal.
Yeah, thank you. So the book's The Autoimmune Answer. It's hardcover, softcover, Kindle, Audible, all on Amazon. You can find that. You have to pay if you go there, which I don't mind if you do that. If you do, please leave an Amazon review if you like the book. But if you want the free copy, you can go to my website. It's functionalmedicincharlotte.com/free, and you'll be able to download a free audio version of the book right there. YouTube channel, if you just search Functional Medicine Charlotte on YouTube, I've got a channel there. I'm close to 1,000 videos on there. Instagram is Functional Medicine Charlotte, and Facebook's just John Bartemus. And again, the website's functionalmedicincharlotte.com.
Perfect. And on that, we're going to wrap up. Thank you so much, everyone, for listening. And again, Dr. John, thanks for being here today.
Thanks for having me.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.